All attendees are in listen-only mode.
It's Susan Kaufman. I'm here for Attitude Magazine on this, at least in New York, beautiful fall day in ADHD Awareness Month. Every October, as part of our celebration of ADHD Awareness Month, Attitude invites the most acclaimed experts to share their wisdom with all of us. It's an opportunity for us to really hear from the stars in the field. So today we're really honored to welcome Dr. Peter Jensen, President and CEO of the REACH Institute. It's a nonprofit organization that he founded in 2006 to disseminate interventions for child and adolescent mental health. He's a professor of psychiatry and the acting director of the Division of Child and Adolescent Psychiatry at the University of Arkansas School for Medical Sciences and the Arkansas Children's Hospital. He is a passionate advocate for children's mental health and the author of over 300 peer-reviewed articles and chapters and 20 books, and has received awards for his research, teaching, and advocacy from many national organizations. So we're very honored to have him. Dr. Jensen, thank you for being here today. His topic today is the parenting lessons learned from over 100 families who successfully raised happy children with ADHD, and some of the topics he'll address are the questions that every parent should ask their child's doctor, how to find your way to the best treatment plan, how to get your school on board with accommodations that work, how to win over unsupportive family and friends, a topic that all of us are familiar with, inspiring better behavior without yelling or spanking, and how to negotiate meds with a resistant teen. These are sort of pretty much the top 6 questions and topics that concern all parents. Before we start, let me just tell you a bit about how this works in case you post them at any time while Dr. Jensen's speaking or afterwards. He will present a slide presentation, which he's going to go through. You'll see it's got a great deal of detail in it, and he's going to go through it fairly quickly. Don't be concerned about that. You'll have a chance to download it on our website, attitudemag.com/webinars, or download it now in the control panel. It is below the question box. Above the question box. You'll see a little section that says handouts. So click on that and download it if you'd like to have it to follow along while Dr. Jensen's speaking. And after the session ends, you'll find a complete replay of this webinar, a video replay, including the slides on the Attitude website, attitudemag.com/webinars. We have tons of great webinars there, podcasts with lots of wonderful information, so I urge you to check out attitudemag.com/webinars. So with that, let me turn it over to Peter Jensen with our thanks and looking forward to his presentation. Thank you so much again.
Thank you, Susan. It's a real pleasure to be invited to do this, and I have, as Susan has said, been passionate about making sure that the very best information about the interventions for children with ADHD, as well as other, mental health and behavioral issues, get to the parents and the doctors who need them. And I actually started the REACH Institute. I've been at NIH for 10 years, back from about 1990 to 2000. And during that time I learned, we'd started a whole bunch of big trials for the ADHD and depression and anxiety, etc. And toward the end of that time I learned that it takes about 20 years for the new science to get off the shelf and actually be applied by doctors. So I realized that the only way we could really change what was happening is kind of get out of our comfortable offices, arm parents with the latest information so that they could go to their doctor as an expert themselves, knowing the latest research and being able to ask, questions. Is this the best approach? What other approaches? And informing the doctors, because they are on average, whether it be a pediatrician or even a child psychiatrist, 15 to 20 years behind. People kind of learn in the residency, and then it kind of stops. And so, not because doctors are bad people, but really running a small business, and they don't have time to, take out and really new skills. It's not just like attending a lecture. And that doesn't quite do it. That'd be like getting a lecture on how to swim the butterfly and then throwing you in the deep end of the pool and expecting you to swim the butterfly. These are skills, and there's a lot of skills that doctors don't get taught that have been more discovered more recently. How to use medications more effectively, the new therapies, and other strategies that are really essential. And so when I began to realize this, while I was still at Columbia, and I moved from there to Columbia, from NIH to Columbia University, and we thought we've got to really put some tools in the hands of parents. And as we began to think about it, I realized that it's it's a complicated problem. Every child has someone who cares for them, but the child and the family, they may know and want efficacious treatments, but what if the provider doesn't know them? Or what if the insurance company doesn't pay for it? And so we might have all this lovely evidence, but how do we empower everybody, the parents and family, the doctors, the healthcare organizations, to make sure that effective services are delivered? So it's not, telling the doctor something. It's making sure families have that, because they're going to be, you're going to be needed to really push on the system to make things happen. Now, so I got together with Chad of the national organization, and so I put some questions together about some of the most important things they had learned. And the reason I had to do that was because there was so much we don't learn in medical school. And this list here is 8 or 10 of them. You can see they don't teach us this during medical school. And yet these are a lot of parents, the challenges. And I ask parents, one of my favorite questions is, how long, if you think about the time that your child got the diagnosis, the correct diagnosis, say it was ADHD, and you learned about the best treatments, from that point forward, how long did it still take you to get everything working as up to speed? And I've had presidents of CHAD and people who have been in the business with their kids for 20, 30 years, and I've never had a parent say less than 5 years. There was one exception. Most are 5 to 10 years. They know the right diagnosis, they know the right treatment. It takes them 10 years still to pull everything together. The one exception was Matt Cohen, the former president of CHAD, and he's a disability rights lawyer, 2 children with ADHD. And so, he kind of knew professionally how to really kind of push on all the parts of the system. So that's kind of why we need to think about bringing the wisdom of parents together along with the doctors, the doctor's experience, because the parents as experts and doctors as experts are really needed to come together to make this happen. And so when you actually begin to think about many of the problems that parents face, this list will give you, this is just a small list. And so these are just some of the challenges that parents face. And as you look this list over, how many of those apply to you? How many actually apply? I think you'll see that a lot of them often do. So how do you become an expert in your child's ADHD? And you're going to have to, take the bull by the horns and understand that you have to become a very savvy student as well as a savvy shopper for what what you are offered from the system, whether it be the schools or the therapists or the doctors or even your family members who may not get it. Oftentimes in families, you'll get a dad saying that the mom's not strict enough, and there can be confusion about that. Dads can yell and scare the kid sometimes. Or, one parent may be for medication or part of the treatment, the other one isn't. So all these things can be critical things, and yet, again, learn about that in medical school. So how do we actually take those critical questions and bring them together? Now, here's an example. Some questions that parents really, often wonder about, but sometimes don't ask. I think, I noticed that in myself. I could go to a doctor for my own health care. The doctor says, okay, well, we're going to do this and this. For me as a doctor, it's kind of scary, intimidating to say, well, why, can you tell me more about why you choose this treatment? What are the other medicines? And, now I'm a little bit better at it now, but I'm not great at it because I'm often afraid, the doctor will think I don't trust them or they'll be offended or something. And yet, if that's the case, we probably have the wrong doctor. So how do I get comfortable? Because at the end of the day, as a parent, I'm the most important decision maker. And I have to decide when to, for a deck of cards, when to hold them and when to fold them. And when I may need to find a different therapist or a different doctor. Now here's questions people hardly ever ask. So those first questions are bad enough, but how about, are you board certified? How much experience do you have treating ADHD? How have you succeeded? You talk to the doctor or the therapist to make sure that the maximum treatments are gone. So now these are interesting questions, yet in fact we need to know the answers to them if we're going to make sure children have the best outcomes. Now, so in these 100 parents that worked with me on this book, and what I did is I approached Chad and I said, let's talk with, let's find out from the Chad parents who've been around the block, who really understand what it takes to succeed. I asked them to tell me the experiences they had with doctors, with schools, with insurance companies, with family members, with their own kids, and the important things they should do or not do. What do you try to avoid doing, and what are the most important things to do? And I'm going to make this point later, but I'll tell you, I'll come back to this. The amazing thing we learned from most parents is not get your kid on medicine. Most parents said, oh, medicines can be important, but you have to be careful. You can't really force it on a teenage son. You've got to get him involved so he's really understanding his disorder. You start getting into coercion, you're going to break down a relationship, and that relationship is critical, the most critical thing. But what 4 out of 5 parents said is the most important thing was find a doctor that will love your family, work with you. Maybe at times they'll say, okay, well, let's try stopping the medicine for a while. Let's try a different therapist. Let's wait on this. But who actually listens, gets you, gets your child, gets your family, and that where you develop of confidence over time. And sometimes, like you see here, finding the right therapist, you may have to fire them. Now, I'll tell you, just a word on therapist, when the child is young, the most important therapist is not one who sees your child. It's one who coaches you in how to set up little programs at home so you don't have to get upset and yell and scream, because that just makes a lot of these kids go haywire. I've had an ADHD son myself, and, when he was about 8, he said, Dad, and I had a little trouble with my temper and scolding, and I was getting better at it, but I used to have significant temper issues such that he was a little intimidated. So I got better control of my temper, and as I got in better control, he began to open up, and he'd say, Dad, when you give me a consequence, it makes me want to be badder. Wow. That knocked me for a loop. And so I had to really sit down and rethink and work with him and say, well, David, how do we do this? How do I help you? Because I love you and I want you to be able to do this and this, but when I work with you this way, then you get really upset. What should we do differently? I actually had to pull him into thinking. And so it took me a couple of years really to kind of master some different ways of working with my son. So you've got to be ready to become your own expert, whether it be kind of in what you learn about the treatments, but also the diagnosis. I'm often, you can go online and you can go into CHAD and learn what the essential elements of the diagnosis are. So some of the great websites like Attitude Magazine, but also www.nami.org or CHAD, CHADD.org. And you got to really be you got to be an expert. You may not be expert about everything, but you should know more about ADHD, how it affects your child, than anyone else. And then your instincts, once you've got that, are going to be very important to guide you. So here's an instance, in this one parent saying, here's a doctor who wouldn't listen to me at all. He started off these whopping doses. I see doctors just start kids on 3 meds all at once. Terrible idea, bad practice. We always start with one. And in fact, I'll tell you, when we use the ADHD medicines, what we know is when we do them very carefully, usually most doctors are scared of them, but you have to use the dose right. And often it's a little larger, but you don't start with high doses, but you have to keep carefully watching the child's behavior at all times of the day because the child may be fine during school, but blowing up in the evening. Well, that's a different kind of problem than the child who's, having temper tantrums at school and trouble at school, but is fine at home. Two very different issues. Might both still be ADHD, but the therapy and the treatment issues have to be considered very carefully as a function of what you do in what setting at what time of day, and is the medicine working at the right time of day at the right kind of dose. So now I did a study I was struggling with kind of what I saw as the poor treatments across the country, and I took a couple. I've been involved in several studies. The largest study we've ever done in ADHD was called the MTA study. And basically, what this slide shows is, in the left, it says baseline. That means how many kids were in the normal range at the beginning. Well, if you have the good diagnosis, you're not in the normal range for behavior. You're kind of an outlier. And what we did was we did medicine very carefully. We checked in with the parents every month. We made adjustments. We actually checked in with the teacher every month. Then for some families, we offered therapy, a very intensive therapy, putting an aide in the classroom, giving the parents lots of coaching and support. Some families, we gave everything. And that's what you see here in the combination. So if you look at the graph on the right, after 14 months, those families that got very careful medicine, watched each month, and the therapy, 68% of those kids were essentially in the normal range in the classroom. What is that 88% is? We drew kids from their entire classroom. We said, how many kids are in the normal range? Well, in most classrooms, there's a few kids who were problems. So is 88% of kids in a classroom are pretty much in the normal range. After our treatment with both treatments, we got 68 in the normal range, 56% in the normal range with medicine only, 34% with therapy only. This was a very elegant therapy, and you can't get it because it's so intensive. Just state of the art. It's very hard to get it almost anywhere. And notice that last one, 25%. That's what happens when kids see doctors, regular doctors, who don't kind of maximize the medicine or the therapy. So doubly better the outcomes for high quality medication care and even the combination. So that's pretty sobering and scary, which means we got to know what we're getting and know how to evaluate it. Now, this is what parents told us afterwards. As you can see here, we said, would you recommend this treatment to other parents? And, no parent says, oh, great, let's put my kid on a stimulant medicine. So parents aren't necessarily ever start off being this great fans of medicine. And so notice here, strongly recommend medicine, well, only 43%. But look at the combination. 79% said, wow, this is really great. And the behavior therapy, parents really like to be at the behavior therapy because they can do something. It teaches them new skills. And so I always advocate getting these skills. And in fact, that was one of the purposes of the book that I'm going to show you about, because it provides those skills. And there's two books together that could be very useful to you. One focused on how do you work with all these challenges. The other focused on how do you actually become expert in that, delivering that kind of therapy yourself. If you pull all that together, you should be in the category here of 79% of saying, this is really working. But it takes time. With my own son, as I mentioned, it took me almost 2 years to really master the therapies and the approach to my son. Now, this slide basically shows when we go out and do studies, we find that families want, 40–50% of families want more school services. They want behavioral help. They want therapy. But the difference between the two colors is, as you can see, most of the families who want additional school services, 59% don't get it. Most that want more help with the child's behavior, more than half, 54% don't get it. Most that want really good therapy, most can't find it. But when you want meds, no one ever starts wanting meds because it's usually because they haven't found anything else. 6 out of 7 in this study of a couple thousand kids, 6 out of 7 who said, yeah, my child has ADHD, who wanted meds, were able to get meds. So meds are easy to get. It's not necessarily always being delivered with high quality, which is part of the problem. So we have to learn as parents to become savvy shoppers. So here's the book that we did with Chad. And so I'm not advertising the book here, but this is a Bible for you, chock full of parents' guidance, in addition to the doctor's guidance of what you have to do with the school system, with the doctor who doesn't quite get it, with the in-laws, even with your own child. And I did this with Chad so that half of the royalties would go to Chad to continue supporting parents in this. Now, there's another book by Russ Barkley, and those two books should be used together. And I think it's called Taking Charge of ADHD. So if you just go to Amazon, you can get both of these probably for about $20, or just go to your library. $20 total. They're both pretty cheap, and or get them from your library. But become an expert. So here's some of the things that I think that as parents we have to kind of think about. First of all, we have to be ready to be in charge, not be intimidated. Understand that you'll make mistakes along the way, and but your child can succeed, can have a great life, but you've got to get that. And I see many parents who are worried, oh my goodness, my child has ADHD, he's going to become, maybe it's his life is ruined. No. When the family support is there, and when the child has a skill, and when you master the skills of loving your child, even though times are difficult to love, most of these kids turn out pretty well. And so that really means, as I had to do with my own son, I had to get into his heart. I had to take him fishing. I had to bite my tongue so many times when the easiest thing to do was criticize. And I had to turn, into positive things, of ways to think about, so he could begin to feel good about himself and could advocate for himself, and could say, I'm good at this, or I'm good at that. Um, and, when he had difficulties, I'd say, well, how can I help you with that, son? I really want to help you. Rather than with my other kids, I use my plain old normal parenting practices, which was like, stop that, don't do that. Hey, I told you to stop that. Go to your room. I was not a great parent. But I tried that with my ADHD kid. It made things horribly worse. And so my other kids, they just, I have a great relationship with all of them now. They're all between 30 and 40. But what the child needs most from us with ADHD is good self-esteem, a feeling that his parents love him. And you can say you love your child, but if the child doesn't feel loved, that's a problem. That's the critical problem. So how do I work with my child so my child feels loved? How do I console him when he's had a bad day at school? So he needs some area where he can feel good about himself. And, of course, that also means we have to think about the medicational needs and the educational needs. And then what does the family need? People need to have fun together and reasonable sibling relationships. And the parents have to become a team and kind of minimize the home conflict. So there's a lot of things here. If those are in place, medicine is going to have a small effect. And the behavioral therapy will be a positive effect. But at the end of the day, those things really have to come together, and your child will have a great outcome. I'm just going to cover a couple more points, and then we're going to turn to questions. So you need to have that doctor who's really willing to work with you. And if he doesn't want to give you the time, he seems impatient, you're going to have to find someone else. And the easiest way to find a great doctor is to go to a CHAD meeting and ask the 20 or 30 parents, or join the CHAD chapter in your local area, or go online and say, what's been your experience? Who's been a really good doctor for ADHD? And the 1,000 parents, 100 parents out there have had a lot of trial and error experience and will be able to tell you some things. And so these are just some questions that you might want to think about that you could ask your doctor, begin practicing when you have concerns. If you aren't comfortable asking the doctor these questions, first of all, try them out on your spouse. And then if your doctor blows up on these kinds of questions, you're going to have to find a different doctor in the long term. And that's going to be the most important thing. So, in this information I put together, the parents put together a book, what they shared with us, and I can't give you the whole wisdom of everything there online now in this quick time, but how parents had to struggle to get the right kind of diagnosis, and what they had to do was workarounds when a doctor blamed them or didn't seem to get it. And again, not things I learned in medical school, but parents learned a lot. And so the number one goal, I think as a parent, is you want to be your child's champion to the school, with the doctor, with the therapist, and because you know him best. And no one will ever love your child as much as you will. And so that's why you want to make that relationship as positive and supportive as you can. And then you can use that to build your child's self-esteem. And when they hit the skids because of some other difficulties, you'll be there to comfort them, support them, and teach them how they can have a good life and succeed. And what we know is when kids have that kind of support in their homes, they'll tell you, because now we've actually followed some 600 kids into young adulthood, half of them are doing very well, thank you, more than half, and it has to do with these kinds of supportive relationships. A lot of them aren't taking medicine because they don't want to, and say, no, I really don't want to. And so at the end of the day, medicine may be helpful, but the therapy, but it's having a knowledgeable kid who understands, hey, I got ADHD, but I figured out how to work with it. And that's going to be what's important. So I'm going to, you can actually look at the next 3 or 4 slides for yourself. I'm not going to discuss them. I want to go right to question and answers. And you can use the slides to actually, or go to the book, and you'll find just chock full of information about all of these areas, how you address the school problems, the home and family problems, the problems with insurance companies, you know, you name it. It's the parents who've been there and seen it and done it are the ones who know, who really know how to succeed. And these are all parents who had kids kind of in their 20s, or late teens and early 20s. So let's stop here, and I will. I'm open for questions. Susan, how do we do this? Hello? Hello?
Hey, Dr. Jensen, hang on one second. We may have a problem on Susan's end. I'm just trying to see if we can. Okay. Not sure what happened with Susan while we try and get her back on the online. We've got a lot of questions here, so let's just dive right in. And I saw one question that somebody said, very simple question, that they don't have a local chapter near them. Are there any suggestions that you can make?
Yes, great question. Well, Chad has some online support resources, and they even have some webinars and training programs you can take. And also, if you go on line, so Chad's the first place I would start, but there are multiple chat rooms that will support, you know, parents talking about ADHD. Chad's the first place I turn, but there's another organization called ADA, the Attention Deficit Disorder Association. It has also chat rooms where you can put questions. And so those are two very good resources. In fact, I'm just going to do a fun little Google search here right now to say ADHD chat rooms. And I'll tell you what I find. Chat forums. Rooms. Okay, there's a, and looks to me like, here it says something even under under the Attitude magazine, but clearly you have, I see on the first page, looks like a lot of things that could be very useful. I see something called ADHDnews.com where they have chat rooms, ADHDforums.com, and so having that kind of information support is just absolutely helpful.
I've called in. Stuart, can you hear me now?
Yes.
Dr. Jensen, can you hear me now? Sorry about that. Not sure what happened. I just disappeared. Dr. Jensen, can you speak to the difficulty of getting teens to consider or keep taking meds? You alluded to that in your presentation. I think it's experience that many parents have.
Yep, absolutely. Well, first of all, yeah, everybody said, oh, well, you know, kids with ADHD have more accidents. But it's not like 10 times more. You know, if you look at the figures, you know, some are, yeah, so there's a slight, modest increased risk. So that's a worry. While I worry about that, you know, my own son, and as a physician, if I am working, first of all, when I work with kids, I began to teach them when they're 6, 7, 8 to rate their own ADHD symptoms. Now, we know that kids aren't very reliable at it, so we still get information from parents and teachers, but then we want Johnny or Jill to look and see kind of, oh, yeah, the teacher noticed this, my mom and dad noticed this, and so we put all that information together. And over time, I try to teach the child with the parent that to monitor how his ADHD is working. And many times the kid will say, I want to go off medicine. That's what I say. I don't say no, and I don't say yes. What I say is, well, okay, I think, and this is I do from once they get to be 12 or 13, if you say you will be on medicine, young man, or else you're gonna do something. If there's heat there, you're facing a much bigger risk with the relationship. And then the kid is going to go a different direction. It won't just be with cars. It might be with other things. So what I do is I say to the kid, well, why don't we test it out? Pick your favorite teacher, and you and your mom and your dad and maybe this other teacher. We'll have the medicine 1 week, and then the next week we won't say your teachers. We'll have them fill it out again. And maybe the third week, maybe we're on different doses, low dose, medium dose. And so I get, rating scales like Vanderbilt's or Connor's. And I'm now, and then the kid says, wow, homework is harder. So I'm educating him to actually see that just like if he had diabetes, I have to take my insulin. I want to take my insulin. I feel bad if I don't take my insulin. But in this case, he has to learn about kind of the consequences that he or may not always feel. If he feels like he's boring or dumb or too focused, maybe we're going to have to work with that kid to find a different medicine that still benefits him. So I never say to a kid, you must take the medicine. And what I say to the parents is, we have to support him. Let's do it as a test. And then parents sometimes incentivize, and they'll say, look, we want your meds. So I'll tell you what, if you'll take the meds, then we'll do the following. And so then there's almost like a negotiation between labor and management. So I send parents and teens out and say, no, I ain't going to prescribe as long as John feels this way. You guys go home and talk about it. See if you can work out kind of a deal of maybe what John would be willing to do, what you'd be willing to do, and then I'll prescribe. And so coercion, it does not work. Bargaining works.
Dr. Jensen, your sound is cutting in and out. I'm not sure whether there's anything you can do with your headset to be closer to it, but okay. That last answer we heard very little of.
Oh, I'm so sorry. Is this better?
No, that's okay. That sounds better. I think I'll translate. I think what you said was, and correct me if I'm wrong, that coercion absolutely does not work, that you need to help your child understand and make his own decision about the benefits of medication if he or she is going to continue to stay on medication.
Bargain with the kid. Talk,
bargain.
What kind of deal you can work out. And so, because remember, they're autonomous individuals, and if they start resenting this, surest thing they're going to do is refuse to take it, stop taking it as soon as they're out of the household.
Okay. Can you talk a little bit about diagnosis? It seems that just in looking at the questions that have come in, it's a significant issue for people. What's the best age? How young is too young? And how do they go about getting a good diagnosis? Many people seem to find it quite difficult to get a diagnosis. They may suspect that their child has ADHD, but they're not certain.
So the diagnosis is really well worked out, and so let me tell you several elements. We know that every kid at times can be inattentive. Every kid can be hyperactive and distracted. Every kid at times can be impulsive. But what we know about ADHD is that where it becomes so persistent across multiple settings that it's now he can't do the things that 90% of the other kids in the classroom can do. Now, this gets complicated. You might have a child, teacher just loves this kid in first grade, has a great kindergarten teacher, and they just think he's special, and they bring him up front, and his attention's wandering, and they have a little trick of putting their hand on his shoulder. And then you got a second grade teacher who is, just a 3 R's kind of teacher. Doesn't cut him any slack. Begins to scold him. Well, that same little boy that was doing well for a teacher who really gave him special attention is going to blow up. Now imagine, so if you gave every kid with ADHD a single tutor, most ADHD that we see in schools would vanish, because a single tutor can do fun things, keep them excited and engaged, and says, hey, we've been talking about, amphibians, now let's go down to the creek, see if we can find one. And so the trick around the diagnosis of ADHD is it looks like it disappears in some settings. Give a kid a Game Boy, and he'll be on it all day long. Why? Because it is a very different stimulus. It's exciting. It's quick. It responds. You press a button, it does something immediately back. Think of a charging tiger or lion with an ADHD kid. Do you think the kid's going to have trouble paying attention to a charging lion? No way. He's getting out of there. We all would. And so powerful emotion, things that the kid is really fun for the kid, that engages their attention, these kids will do just great as a rule. But if you give them something boring and things they don't really want to do, most kids can say, oh, I got to do this homework. Okay, I guess I'll do it. And they can kind of force their brain to go into that concentration mode. These kids, it's like lifting a heavy weight. Now, in terms of finding the right doctor, go back to my questions about what you need to ask the doctors. And I can tell you the following. In addition to those questions asking about their experience and how they were trained, they should be getting checklists information from you and from the child's teacher, and just be getting the good history. And so if a child's, so everything that's inattentive isn't always ADHD. A child could be anxious. Parents are going through a divorce, and the kid is now anxious, can't sleep, worried about mom, that kind of thing, and will look ADHD, where he maybe didn't before. So stresses or depression can bring these things out. What makes it complicated is you can have ADHD, and then because you're struggling everywhere, begin to be demoralized and feel depressed because you're always in trouble. So you need a good diagnostician. What we are doing now across the country is training not just child psychiatrists, but as many pediatricians as we can get our hands on. One thing as a parent you could do, go to our website, first of all, www.thereachinstitute.org. REACH stands for, you saw, the Resource for Advancing Children's Health. We've trained about 2,000 doctors in a 6-month-long training program. If you have a doctor who needs to know more, say, it'd be really great if you could go to this training. Your doctor you'd like, and you wish you could maybe learn a little bit more. Doctors love this training, and we're doing it in many states. Often states pay for it, but sometimes doctors just pay for it on their own. So learn what the diagnosis is, study the books, study the Russ Barkley book, study the book I told you about. It gives you the information. You're going to have to become your own expert. What makes it ADHD versus anxiety versus bipolar? I'll tell you, bipolar is way overdiagnosed. For every 10 kids I see that have been called bipolar, it's just ADHD that's gotten really bad with anxiety and depression and anger, et cetera, et cetera. So nothing better than becoming a savvy shopper. Susan, you there? Let's see. Somehow we lost Susan.
We lost Susan again. Hang on one second. Just trying to get back.
Do you have any of the typed questions there that you could read out to me and I could handle?
Yeah, well, we have a lot of questions that people have been submitting. How about, let's talk about defiance and or temper tantrums.
Oh, great. Okay, great questions. Okay, so Half of kids with ADHD have what we call oppositional defiant things. So they're basically they're more irritable. They're more irritable for a lot of reasons. So about half of them will have defiance and temper tantrums. And it's, in a way, their brains are built a little bit more different. So that where most of us, when there's something that we think of and we want, it comes to our mind, and we can think about it, we can say, be patient, I'll get that later. What happens to an ADHD kid is it comes in, and they have little ability, which is one of the things they have to learn through coaching, to kind of hold it in mind and be patient and wait. And so now, in addition to that, they're getting bad feedback all day long. Maybe they're getting scolded by the teacher. Other kids don't treat them nice or tease them. They feel like they're always in trouble at home. And then that's just a setup for more irritability. And so now the medications not only treat the ADHD, but we know that most of the oppositional and irritability can be effectively addressed, but not totally addressed with the medication. The combination of teaching parents how to use reward systems and gentle behavioral consequences, that's the model way. So the right medicine usually is going to be a stimulant. You have to make sure the dose is right at the right time of the day. Because if they're having temper tantrums at home and not at school, may well be that the medicine is run out. It's 4 o'clock. And now we're in the woods, and it isn't just that he's having a temper tantrum. He's had a bad day, was scolded, half a dozen times, got in trouble, maybe. Or the medicine's wearing off, and that, a lot of these kids, when the medicine wears off, they get really edgy. And so we have to make sure that when the medicine wears off, it's around bedtime, and not around 4 or 5 or 6 o'clock, because it's gonna go haywire. So the temper tantrums are part and parcel. Parents, like me, I had to learn how to deal with my son's temper tantrums. The first thing I had to learn to do was bite my tongue and not lose my temper. And then I began to kind of set up a little reward system, saying, "Gosh, Stephen, you did a great job. You only had 2 temper tantrums today, and last week you had 4, and you're really getting the handle on this thing." And so I began to reward him for having fewer and fewer temper tantrums. So we did earn little points, and then we'd take a fishing trip together, go to McDonald's. But then I had to be there praising him. "David, you're doing great. You're getting along with your sister, your brother." And so oftentimes parents just forget. We just say, "Oh, kids are being good," and we don't go out and comment positively. What happens if you listen in most of our homes, if you listen to how parents talk to kids, with an ADHD kid, 4 out of 5 comments are usually a negative criticism. That's dynamite. That's just the wrong problem. That's the wrong strategy. Got to find a way to ignore some things and go for the big things, and to find a way to get 4 out of 5 comments to be positive. And that takes time. It often takes a good behavior therapist. But those tantrums are totally workable and controllable, but you need the right medicine at the right dose and the right time, and you need to learn those skills in Russ Barkley's book.
There are a couple of questions that are of similar in nature, so I'm going to put them together as we're starting to run out of time. Question about grandparents and spouses. If you've got grandparents who don't understand, you have a spouse who isn't on board, how do you try and manage to get a consistent way to deal with the child?
It's a wonderful question. One of the deeply moving things that I learned from parents when they responded to that very question, they said, we would go to my brother or my sister or our parents, and they were mean to our child and just thought it was all misbehavior. And so we just had to back out of that relationship. and not take him there. We had to protect his self-esteem. So that was certainly the most dramatic instance that I could, that I saw parents talk about. But on the other hand, they would give them things to read, encourage them to come with them to a CHAD meeting. So getting some of the good information from some of the websites like CHAD or things that are available through Attitude or through NAMI, encourage people to read. And the advantage of all these sites is it's good science. There's a lot of crazy science out there where, Scientologists or other kind of flaky groups are saying, oh my goodness, this destroys kids' brains, shrinks kids' brains. You can find all kinds of crazy stuff on the web. Last time I looked, there's like about 145, you type in ADHD, it's about 145 million places you can go. And so you have to go to the correct sources with strong science behind them, like CHAD, like Attitude, like NAMI. And actually, in my book, I give a whole chapter on teaching parents how to really become savvy shoppers on the web and how to separate sense from nonsense and sense from science. And then you're going to have to make that information available to your family members. But I've had parents tell me they had to leave their spouse. I mean, it can sometimes come to that because they had to protect their child. And the other one just did not see it that way. And so that's a tough road to hoe.
Great.
Education.
Question about when you have children with multiple diagnoses in terms of deciding how to decide which condition to treat first.
Lovely question. Most kids with ADHD actually have more than one diagnosis. About 70% have two or more. And so the most common one is actually oppositional defiant problems, but also a third of them will have anxiety, some number will have depression, a quarter may have learning disabilities. The thing about ADHD is as far as the medicines, it's so treatable so quickly. I mean, 70% of kids will respond to medicine. You'll know that in the first week. It may not be the right dose, but you'll see an effect. So you can very quickly do that. On the other hand, it's easy to start there. On the other hand, though, if a child is extremely depressed, and it does happen, it's not common, but 1 in 20, 25 kids with ADHD might become significantly depressed and want to die. Well, you're probably going to start really working right away on the depression. I probably wouldn't wait to treat the ADHD either, because if they're depressed because of their ADHD or anxious because of their ADHD, they're afraid they're going to fail or get in trouble, etc. So in most cases, we make sure that we've got the ADHD treatment as quickly as possible on board, along with the therapy, whenever we can get that. Then we have to address the learning disabilities. So those are the ones you're going to find. Learning disabilities, oppositional problems, a lot of anxiety, depression. Very rare to have an ADHD kid with bipolar disorder. Just because the kid has temper tantrums, which is not bipolar disorder. So again, you've got to become a savvy shopper and knowledgeable, because some of your doctors out there follow the latest fads and fashions and are sometimes misinformed families.
We're just about out of time, and there's still so many more questions here to ask, so we're going to have to stop to wrap it up. Would you like to just sort of summarize your last thought in terms of what's that last piece of advice you'd like to share with share for parents?
Absolutely. So the most important thing that parents said, and I would say as a doctor as well, find a way to build a very positive relationship with your child.
and learn to love that child, and then teach that child, just like you're his coach. Become a coach to that child to help them with the difficulties and the problems they have, because none of these kids lie in bed in the morning and think, oh, let's see, I think I'll have a couple of temper tantrums today. And then I'll get sent to the principal's office. Then I'll get in trouble when I go home. My parents will take away my Nintendo, and I'll cry and I'll fuss and I'll feel, what a great day. No one thinks like that. No kid thinks like that. Their brains are different. And so it means we have to accommodate those brains, just like a learning disability. It's another form of a learning disability that many, many kids can work through as their brains mature over time. My son, who's now close to 40, when he was 21, 22, we were looking at family movies, and he had a lot of problems with aggression. And he said, as he's watching these, when he was about 6 and his little younger brother was 4, he said, oh, I was so mean then. He has no recollection of those behaviors. He didn't have the insight. It took a while for the brain to develop, but we had to kind of protect his self-esteem and other things during that time so that he came out, and he's a fine young man. And so most of these kids, with that love and support, and then a good doctor, you can have a great outcome with many of these kids. We have CEOs, we have famous baseball players. I think we've even had presidents. We have a lot of successful creative people out there with ADHD. We just have to understand how to work with them and support them. They'll take a little extra and a different kind of help that you need to master. Well, thank you for having me.
Thank you, Dr. Jensen. We really appreciate it. And we thank you for bearing with the crazy technical problems that popped up today. For everybody who's still here, remind you, if you haven't already, you can get a copy of the slides right in the handout section in the control panel, or you will be able to get the slides as well as access the replay at www.attitudemag.com/webinars. And want to remind people, next week we'll be back with Just Diagnosis, How to Succeed with Adult ADHD with Michelle Novotny. And we'll see you then. So thank you, Dr. Jensen, again, and everybody have a great week. Goodbye.
Bye-bye.